So LaShawn, I want to start with you. I was hoping that you could sort of give us a lay of the land, so to speak, and talk through where we are really as a culture in facing this disease, and how many people are facing it, and the whole landscape.
Sure. One, I'm really excited to be here today. As she said, today is World Diabetes Day. This is American Diabetes Month. And really our focus during this month is to talk about the seriousness of diabetes, to try and combat the stigma surrounding diabetes, and to really help people understand just the magnitude of this disease and why it's important for us to act. So I think the first thing I want to share is the scope of the disease. Nearly 50% of Americans have diabetes or prediabetes. And so that's 1 in 3 Americans are at risk for developing diabetes. Diabetes affects 30.3 million children and adults in the US today, and so that's 1 in 11 Americans. One thing that we find is that no one really believes they're the one. And so there's a huge issue with people who are at risk for developing diabetes. There are 84.1 million Americans who have diabetes and are at risk for developing type 2 diabetes. And nearly 90% of American adults with prediabetes don't know that they have it. So those are just some of the numbers in terms of the scope of the disease. But why is this really important? Well, it's important because diabetes is a costly disease. If the complications go untreated, it leads to significant challenges for people living with the disease, and also it has a great economic cost. So it is the 7th leading cause of death in the United States, and it causes more death than AIDS and breast cancer combined. In addition, I talked about the complications. So blindness is an important complication that it causes, heart disease, stroke, kidney failure, and amputations. In understanding the economic burden of diabetes and prediabetes, it costs $322 billion each year in terms of healthcare related costs. And those is 2.3 times higher than someone else with diabetes. So it's a very costly disease. It carries a great burden for people who live with the disease. And today we're talking about, or part of what we're discussing is World Diabetes Day globally. According to data from the World Health Organization in 2015, 422 million people worldwide are living with diabetes today. So this is a huge issue as it relates from a public health perspective. And I think it's important for the folks that are gathered here today to talk about some of the solutions and how do we move forward from here.